Hello everyone, welcome back to another episode of Coder Web Training. Today we are excited to dive deeper into our medical terminology module, and this will be the last session in our medical terminology course. Let's get started. My name is Saman Gamge. I work as a senior technical advisor on medical certification and ICD under the Data for Health initiative of the CDC Foundation. And I'll be your guide through this presentation along with Patricia Wood and Yusuf Hemant. The lesson today is Basic Term Components Part 3. This is the third session of Basic Term Components. We will discuss the basic term components in more detail. The objectives of today's session. Last month, we learned about defining component parts of medical terms, using basic prefixes, suffixes, and combining forms to build medical terms, and common rules for proper medical term pronunciation and spelling. After completion of this lesson, you will be able to analyze the component parts of a medical term, list basic prefixes, suffixes, and combining forms. The lesson plan. So this is how I have lined up today's topics. I will first discuss or remind you about component parts of a medical term. Then we will discuss common prefixes, common combining forms, operative, symptomatic, diagnostic, and general suffixes along with their meanings. And also, we will discuss some ICD coding examples. As you know, and as you have learned before, most medical terms have three components: prefix, root, and suffix. Prefix, root, and suffix. Any medical term should have following components: at least one root and a suffix. At least one root and a suffix. Any medical term. Each term is formed by combining at least one root and a suffix. Each term is formed by combining at least one root and a suffix. Root is the foundation of the word. Suffix is the ending that modifies and gives essential meaning to the root. During previous sessions of basic term components, you learned all this. Here is an example. Lipemia. Lip means root and lip means fact. Emia is the suffix. Emia means condition of blood. So lipemia, when you combine the two, the word is lipemia, which means presence of fat in blood. Before I start today's session, I want to remind you about flashcards. Therefore, before we dive into today's lecture, I want to remind everyone of the importance of preparing flashcards for your medical terminology studies. They are a great tool to reinforce your learning and help you retain key concepts more efficiently. So if you have already prepared your flashcards, you can update your flashcards. If you haven't done it so far, please prepare your flashcards, and you can watch this video, and while watching the video, you can update your flashcards. Let's move on to the prefixes, common prefixes. As you already know, A prefix is a word structure at the beginning of a term that further modifies the root or roots. Prefix comes at the beginning. So here is an example: hyperlipemia. Hyper is prefix, which means excessive. Lip means root, which means fat. And emia is the suffix. Emia refers to a condition of blood. A condition of blood where you have excessive fat. Presence of excessive fat in blood, hyperlipemia. We will go through some common prefixes. So in this table, in the first column, you can see the prefix. The second column, you can read the meaning. And in the third column, you will find an example. Prefix A meaning without. Aphonia, without sound, no sound, absence of sound. An means without. Anaerobic, without air. Anaerobic, or without air, without oxygen. Ab is a prefix giving the meaning of away from. Abnormal, which is not normal, away from the normality. Ad means to or toward or near. Adhesion is something stuck together. So when a surgeon operates and opens the abdomen, sometimes he might say there are adhesions. That means some tissues are stuck together. Ambi means both. Ambidextrous. Ambidextrous means ability to use both hands equally well. Yes, that means in some people, the right hand is dominant, and some people, left hand is dominant, and they can, if someone can use both hands equally well, this is called ambidextrous. Some more prefixes. Anti. Anti means before. Antepartum, before delivery, before the baby is born. Partum means delivery. Antepartum means before delivery. Pre gives a similar meaning, before. Premature is before maturity. So some people say the baby is premature. Baby is born before he is matured. Pro means again before. Prognosis. Prognosis means expected or predicted outcome of a disease. So when someone is having a disease, so he may question, doctor, what is the prognosis of my illness? So this is the expected or predicted outcome of a disease. Anti, A-N-T-I, anti means against. Please note the difference of two anti. Anti, A-N-T-E, anti is before, A-N-T-I, anti is against. Anticoagulant, an agent used to prevent blood clotting. As you know, blood, when drawn out of the body, they can clot easily. And this is due to the coagulation factors in the blood. Anticoagulant is an agent used to prevent blood clotting. It's a compound or chemical compound. Contra means against. Contraception. So against conception, to prevent conceiving a baby, contraception. Bi means two or both. Bilateral means both sides. Right side and left side, both. Some more prefixes. Brady means slow. Bradycardia is slow heart, slowing of the heart. The normal heart rate is 60. If it is less than 60, we can say the patient is having bradycardia. Circum means around. Circumvascular. Circumvascular means around blood vessels. Around blood vessels. Peri means around. Periosteum. The tissue surrounding a bone. Periosteum. Con means together with, congenital. Born with, congenital abnormality. So some abnormalities the babies are born with. Congenital heart disease. The baby is born and he is born with a heart disease which is present from birth. DED means from, down, not. Decapitate. Decapitate. You cut off the head. Dia is across or through. Dialysis. You may have heard about this term. This is a process, a medical procedure used to remove waste products, excess fluids, and toxins from blood when the kidneys are no longer able to perform these functions. There are different ways we dialyze patients. There's peritoneal dialysis and hemodialysis. Okay, some more common prefixes. Trans. Trans means across or through. Transmission. Dis means separate from. Dislocation. Separate from the original location. For example, if a joint is dislocated, we can say dislocated. Shoulder joint dislocation. The humerus is dislocated from the original position. DYS, this means painful, difficult, dysphonia. So speaking is difficult. Hemi means half. Hemicephalic. Hemicephalic means pertaining to one half of the brain or the brain hemisphere. As you know, there are two hemispheres in the brain, right and left. So this is pertaining to one half of the brain. Semi, again, is referring to half. Semilunar moon means half moon shaped. Semilunar. Lunar means moon. Semilunar is half moon shaped. Some more prefixes. Hyper is excessive. Hyperlipemia, we already know about this term, presence of excessive fat in blood. Hypo means deficient. Hypothermia is the body temperature is less than normal. The normal body temperature is 98.4 Fahrenheit. If it is less than normal, it is called hypothermia. Inter means between. Intercostal. Intercostal means between ribs. Micro is referring to small. Microlith means a small stone or small calculus. Ecto, endo is within. Endoscope is an instrument used to examine interior. There are gastroscopes to examine the interior of the stomach, esophagoscopes to examine the interior of the esophagus, colonoscopes to examine the interior of the colon. They are all endoscopes. Ecto means the opposite. Ecto is outside. Ectopic means presence of outside. For example, ectopic pregnancy. Pregnancy usually happens inside the mother's womb, inside uterus. However, rarely pregnancies can happen outside uterus, maybe in the tubes. So this is called an ectopic pregnancy. Let's go through some common combining forms. Before we go through common combining forms, I would like to remind you about combining vowels and combining forms that we learned during the previous sessions. When a medical term has more than one root, each is joined by a vowel. When a medical term has more than one root, each is joined by a vowel. O is the most common combining vowel. Combining vowels used to join root to root or root to suffix. Not only a root to root, but also a root to suffix. The combining vowels are used. For example, lip is the root. Lip means fat. Lipo is the combining form. That means combining form is root with a combining vowel attached. So when you say combining form, it is a root with combining vowel. Combining form, a root with a combining vowel attached. Let's go through some common combining forms. In the first column, you will see the combining form. In the second column, the meaning. In the third column, an example. Abdomino means abdomen, your tummy. Abdominal means pertaining to abdomen. L means the suffix. Laparo means again abdomen. Laparotomy is incision in the abdomen, a cut in the abdomen. Adeno is gland. Adenoma is a tumor arising from glands, a neoplasm arising from glands, adenoma. Cyano is blue. Cyanotic means pertaining to blue, pertaining to blue, pertaining to bluish coloration. Cephalo means head. Cephalic means pertaining to head, cephalic. Ic is the suffix meaning pertaining to. Gastro is stomach. Gastric is pertaining to stomach, pertaining to stomach. Some more combining forms. Leuco is referring to white. Leukocyte means white cell. You may have heard about white blood cells. Leukocytes are white blood cells. Lipo is fat. Lipoid means resembling fat. Resembling fat. Oid means resembling. Pyo is pus. Pyopoiesis is formation of pus. Poiesis means formation. Pyopoiesis, formation of pus. Sclero means hard. Sclerosis is a condition of hardening. We talk about sclerosis of arterial walls and sclerosis of some other tissues. That means hardening. Litho is stone or calculus. Lithiasis means presence of stones. For example, urolithiasis, presence of stones in urine. Polylithiasis, presence of stones in bile. Macro means large. So this is the opposite of micro. Macrocyte means large cells. Let's discuss some more combining forms. Oligo is few or deficient. Oliguria means deficient urine output. Patho is disease. Pathology is study of diseases. Pathology. Uro means urine. Urology means study of diseases of urinary system, urology. Cyto is cell. Cytology is an example. Cytology means study about cells. Angio means vessel. Vessel, maybe blood vessel, can be an artery or vein, angio. Angioplasty is repair in blood vessels. Repair in blood vessels. Angioplasty. Plasty means repair or surgical repair. All right, now we have discussed common prefixes and common combining forms. And we have one last combining form, erythro. Erythro means red. Erythro is referring to a color, red. Erythrocyte is red cell. Red cell. Let's discuss about common suffixes. You know what are suffixes? Suffixes are endings that modify the root. They give an essential meaning to the root by forming a noun, verb, or adjective. So root is combined with a suffix, and suffix is able to modify the meaning of the root, and it can provide an essential meaning to the root. There are two types of suffixes. There are two types, simple suffixes and compound suffixes. So let's learn about suffixes in more detail. There are simple suffixes and compound suffixes. Simple suffixes forms basic terms. For example, gastro plus ic, gastric. This means a combination of a root with a simple suffix. Ic is a simple suffix. ic, a simple suffix. Compound suffixes are formed by combination of basic term components. So it's a suffix, but it's not just a simple suffix, it is a compound suffix because within the compound suffix, you will find other basic term components. Simple suffixes form basic terms. Gastro is root, ic means pertaining to, it's a simple suffix. Gastric means pertaining to the stomach. Gastric, pertaining to the stomach. Compound suffixes are formed by a combination of basic term components. For example, tom. Tom means to cut. Tom is a root. Y means a process of. Y is a single letter, but as a suffix, as a simple suffix, it gives the meaning a process of. Tommy means incision. It is a compound suffix. In other words, it's a, a process of cutting, or it's an incision. Tomy, laparotomy, right? Nephrotomy, compound suffix. Another example of a compound suffix, ek means out, and this is a prefix. Tom means to cut, it is a root. Y is a process of simple suffix. So when you combine prefix, root, and simple suffix, it gives ectomy. Ectomy means excision, which is a compound suffix. So generally, when you are asked to separate basic term components, you will consider ectomy as a suffix, but you should know it is a compound suffix, and ectomy is formed by a combination of prefix, a root, and a simple suffix. Ek, tom, y, excision. Excision means cutting and removing. You cut it and remove it. Okay. So suffixes, there are different types of suffixes. There are symptomatic suffixes, describe the evidence of illness. There are diagnostic suffixes providing the name of a medical condition. Then operative suffixes describing a surgical treatment. General suffixes that we use for general application. So basically suffixes can be divided into two, simple suffixes and compound suffixes. And then suffixes are also grouped as symptomatic, describing the evidence of illness, then diagnostic, providing the name of a medical condition, operative suffixes, describing a surgical treatment, and then general suffixes used for general application. Let's go through some symptomatic suffixes. In this table, the first column shows the suffix, the second column meaning, and the third column gives you the example. Algia. Algia is pain. Cephalalgia, pain in the head. Cephalo means head. Cephalalgia is pain in the head. Dynia, again pain. Cephalodynia, pain in the head. So both cephalalgia and cephalodynia gives you the same meaning. Genic is origin. Pathogenic, that means disease causing. Pathogenic bacteria, disease causing bacteria. Genesis, so again origin. Pathogenesis, causation of diseases. Pathogenesis, causation of diseases. Lysis, lysis means breaking down. Hemolysis means breaking down blood, dissociating blood, right? Breaking down blood. Hemolysis or hemolysis. Megaly, megaly means enlargement. Hepatomegaly is enlargement of liver. Hepatomegaly. If the spleen is enlarged, we can say splenomegaly. Splenomegaly. Some more symptomatic suffixes. Oid, I told you before, resembling. Lipoid, resembling fat. Penia is abnormal reduction. Penia is abnormal reduction. When you say leukopenia, leukopenia means white blood cells are abnormally reduced. Leuco means white. Leukopenia is reduction or abnormal decrease of white blood cells. Rhea is discharge. Amenorrhea, absence of menstruation, amenorrhea. Spasm is involuntary contraction. Contraction happening without your knowledge and you don't have any control on it. Vasospasm, spasm of blood vessels or involuntary contraction of blood vessels. So you cannot contract and relax blood vessels. It happens involuntarily. So vasospasm is involuntary contraction of blood vessels. Let's go through some diagnostic suffixes. So in the first column, you will find the suffix. In the second column, meaning. In the third column, the example. Seal means pouching. Gastrocele, pouching from stomach. So something bulging out from stomach. Gastrocele. Ectasis means dilatation. Ectasis, dilatation. Angiectasis. This means blood vessels are dilated. Dilatation of blood vessels. Angiectasis. Emia. Emia means a blood condition. You know this. Hyperlipemia is presence of excessive fat in blood. Eosis or iasis means formation of. Lithiasis is formation of stones. Nephrolithiasis is formation of stones inside kidneys. Itis means inflammation. Appendicitis is inflammation of appendix. Any name of an organ followed by itis means the inflammation of that particular organ. Cholecystitis, inflammation of gallbladder. Gastritis, inflammation in the stomach. Malacia is softening. Softening. Osteomalacia is softening of bones. Some more diagnostic suffixes. Oma is a tumor. Carcinoma, carcinoma, malignancy, cancerous tumor. Oosis, a condition. Sclerosis, a condition of hardening. Philia means attraction for. Pedophilia means people who are attracted to children, small children. Plasia is formation. Dysplasia is abnormal formation. Dysplasia. Ptosis is falling. Gastroptosis, falling of stomach. And ptosis can happen in your upper eyelid. Ptosis of eyelid means you cannot open your upper eyelid and it is drooping. So drooping of upper eyelid is called ptosis, ptosis of eye. Some more diagnostic suffixes. Rage. Rage means to burst forth. Hemorrhage. Hemorrhage means bleeding, excessive bleeding. Ragia means again to burst forth. Menorrhagia. Menorrhagia is excessive bleeding from uterus, excessive uterine bleeding. So rage and regia derived from Greek. And both terms or both diagnostic suffixes meaning to burst forth or to bleed. Rage, some examples are hemorrhage. Hemorrhage means bleeding. Rhinorrhage means the discharge from nose, rhinorrhage. Or maybe bleeding from nose. Then regia, one example is hemorrhagia. Metrorrhagia means bleeding from uterus. Gingivorrhagia means bleeding from gums. Gingivorrhagia. Rhexis is rupture. Cardiorhexis. You may remember last time during the live presentation and also in the last video, we did an example of coding cardiorhexis. Okay, similarly, let's go through some coding examples of diagnostic suffixes. How to code hyperlipemia. Let's look up hyperlipemia in the index in volume 3. And hyperlipemia is here. And you can see hyperlipemia and hyperlipidemia are used synonymously. Hyperlipemia and hyperlipidemia both mean the same. And the code is E78.5, and you can confirm this code in volume 1, tabular list, for unspecified hyperlipidemia, because our diagnosis is just hyperlipemia. So there is no other specification. It doesn't say whether it is familial or whether it pertains to any other group. Nothing. Therefore, we code this to hyperlipidemia unspecified, or this is unspecified hyperlipemia E78.5. The code is confirmed. Let's do another example. How to code acute appendicitis. Very simple and very common diagnosis in extremes of age, in children and in the elderly. Let's look up appendicitis in volume 3. Appendicitis is here. And it is not just appendicitis, it is acute appendicitis. So if you go further down in the column, you can see with one indentation, acute is mentioned. And the code for acute appendicitis is K35.8. If you check in volume 1, under the block diseases of appendix K35 to K38, you find K35 acute appendicitis. And acute appendicitis is not specified because we are not told whether it is appendicitis with peritonitis or not. Therefore, we assign K35.8 acute appendicitis other and unspecified. Acute appendicitis without mention of localized or generalized peritonitis. This is the appropriate code. Okay, these are common coding examples, and we explain how your terminology knowledge relates to your coding. So being coders, you require some knowledge in medical terminology. So that's why we conduct these sessions. Okay, let's move on to operative suffixes. As before, in the first column, you can find the suffix. In the second column is the meaning. Third column is the example. Operative suffixes. Centesis. Centesis means puncture for aspiration. Paracentesis. So when you want to aspirate some abnormally collected fluid from a space, you do centesis. Paracentesis abdominis is aspiration of fluid from abdominal cavity or peritoneal cavity. Desis is binding. Arthrodesis is binding of joints. You surgically bind a joint, arthrodesis. Then the joint cannot be moved. Plasty is surgical repair. Rhinoplasty is surgical repair of nose. Rhino is referring to nose. Pexy is fixation. Gastropexy is fixation of stomach. So when it is moving inside the abdominal cavity, so it can be fixed, fixation of stomach. Ectomy is excision. Appendicectomy is the term used for the excision of appendix. When there is appendicitis, the treatment may be appendicectomy. And some people or in some countries use the term appendectomy. Appendectomy and appendicectomy are both referring to the same surgical operation, removal of appendix. Raphy means suture. Osteoraphy is suturing of bones. Tomy is incision. Laparotomy is incision in the abdomen. Stomy means creation of an opening. So please note the difference. Stomy is just an incision, but stomy is creation of an opening. Colostomy means creation of an opening in the colon. Right? We surgically create an opening in the colon to facilitate bowel movements when some major bowel surgery has been done. Trypsy is crushing. Lithotripsy is crushing of stones. So you can use laser beams to crush stones, urinary stones. This is called lithotripsy. Okay, let's go through some general suffixes. You have already learned these general suffixes before during the past couple of videos, but I will go through systematically some of these general suffixes. In the first column, you will find the suffix. In the second column, meaning. And in the third column, the example. E is a suffix. It's a noun maker. Erythrocyte means red blood cell. IA is condition of pneumonia. It's a condition in the lung. Ism is condition of embolism. Embolism. Embolus is a moving blood clot. Moving clot. So when it is stuck somewhere, it is called embolism. Ium is structure. Pericardium, structure around the heart. I think we discussed this term in the last video as well. Pericardium. The tissue or structure surrounding the heart. Y means condition. Adenopathy, a disease condition in glands. Adenopathy. Then some adjective endings. Ac, cardiac, pertaining to the heart. Cardiac, pertaining to the heart. Pedal, L, pertaining to the foot. L, pertaining to A-R-A, glandular, pertaining to a gland. Ari, again pertaining to pulmonary, pertaining to the lung. L, again gives the meaning pertaining to esophageal, means pertaining to esophagus. Ick means pertaining to toxic, pertaining to a poison, toxic. Some more general suffixes. Us Fibrous pertaining to fiber, fibrous tissue. Cyanotic pertaining to blue, tick. Then there are suffixes, general suffixes given diminutive endings. This means suffixes given the meaning small. Icle, ventricle, small belly or pouch. As you know, in the heart, we have ventricles. So those are small pouches, two ventricles, right and left. All, all means again giving it's a diminutive ending. It gives the meaning small. Bronchiole means small airway. Bronchus is a large airway, but bronchiole is small airway. Ula, again, a small spot. Macula, small spot. Ule, pustule, small pimple. When you have a small pimple filled with pus, it is a pustule. Some more suffixes. Gram is a record. Sonogram, record of sound. Graph is the instrument used for recording. Sonograph or ultrasonograph is the machine or the instrument that you use to record the sound waves. Electrocardiograph, the machine used to record the electrical activity of the heart. Graphy is the process of recording. Sonography is process of recording of sound waves. Echocardiography, electrocardiography. Graphy means process of recording. Logy, we have learned before, study of cytology, study of cells. Iatrics is referring to treatment, pediatrics, treatment of diseases of small children. Iatry is treatment, psychiatry, treatment of psychological problems, mental illnesses. Logist is the one who specializes. Oncologist, the person who has specialized in cancer. Meter is the instrument used for measuring. Spirometer is instrument used to measure respiration, inspiration and expiration. Some more suffixes. Ist means one who specializes in. Optometrist, the person who has specialized in measuring the eye in order to provide the strengths of lenses. Spirometry, process of measuring. Spirometry is the process of measuring or measuring respiration. Poiesis is formation. Hemopoiesis is formation of blood. Formation of blood. Scope is the instrument of examination. Endoscope is the instrument used to examine interior. Scopy is the process of examination. Endoscopy is process of examining the interior organs. Endoscopy. Stasis means stop or strand. Hemostasis. Hemostasis means to stop bleeding. To stop bleeding. Sometimes you may have seen in surgical notes, they say hemostasis achieved. That means bleeding was stopped. Orthostasis is standing straight. Stand straight. Okay, so we have discussed common prefixes, suffixes, and combining forms, and basic term components, and plenty of examples for prefixes, combining forms, and suffixes, simple suffixes, compound suffixes. then different types of suffixes. So it's time to do the practice exercises. So practice exercises are sent to you. So you will receive them via email or on your WhatsApp. So please do the practice exercises before you join the live session on the 23rd of July, right? You will receive the link to the live session, Zoom link to the live session. So you can go through the answers to practice exercises during the live session. And you will receive exercises via email or on your WhatsApp. So these are the course modules we have covered. We learned about why medical terminology is important 4 months ago, and that session was covered. Then building a medical vocabulary, how to improve your vocabulary, right? How to build up your vocabulary. So we learned that. And then we have completed basic term components part 1, 2, and 3. Right? What are the basic term components? Prefixes, combining forms, and roots. Then rules for common rules for forming basic term components, or common rules for forming medical terms. Then rules for pronunciation, rules for spelling, everything we have learned. And during this session, we went through many prefixes, combining forms, and suffixes. So you can update your flashcards and our terminology video series. So this is the last video in terminology, medical terminology. So I hope this video series was useful. And for more information, please contact me. This is my email address, sgamage@cdcfoundation.org. Thank you very much.